which is a fancy name, but it's also known as this is what causes syphilis infection. It is most commonly spread by oral sex, vaginal sex, and anal sex.
I believe that partially we are not being vigilant about over a week screening and treating pregnant women.
Syphilis is not just a simple STD. Ignored, it progresses into blindness, paralysis, dementia, deafness, and demise. Join us to uncover the 3 horrifying stages of this fatal infection. What is syphilis? The bacteria Treponema pallidum spreads like wildfire through coitus. Syphilis, a notorious STD, can be passed from mother to child during pregnancy or childbirth. The symptoms of syphilis vary based on the stage, making it challenging to detect. Testing is crucial for individuals who have been intimately active or have had contact with an infected person. If one suspects they have syphilis, they must get tested immediately. The test involves a simple blood draw or swab of an active sore. Antibiotics are effective in treating syphilis, and it's critical to start treatment as soon as possible. Ignoring syphilis can lead to severe long-term health problems. The thought of having syphilis can be frightening, and rightfully so. Left untreated, syphilis can wreak havoc on the body, leading to severe health issues. From the initial sore to the rash that spreads all over, the symptoms of syphilis can't be ignored, and if left unchecked, the disease can cause blindness, paralysis, dementia, deafness, and even demise. The key to tackling syphilis is to understand the 3 stages of this vicious infection. Each stage is defined by different symptoms, and recognizing these stages can help you get the treatment you need. Stay tuned as we delve into the 3 horrific stages of syphilis and explore the dangers that come with each. Remember, early detection and treatment are crucial when it comes to syphilis.
Which is a fancy name, but it's also known as this is what causes syphilis infection. It is most commonly spread by oral sex, vaginal sex, and anal sex. Syphilis is an infection caused by a spirochete or a bacteria called Treponema pallidum. But is actually very easily spread by oral sex, which is not that similar to other STIs. Syphilis is extremely infectious and it's spread very easily. Like all STIs,
the causes. Syphilis is caused by an insidious bacterium known as Treponema pallidum. This spirochete bacterium has a distinctive spiral shape that enables it to penetrate deep into the skin and tissues, causing damage and inflammation. Once inside the body, the bacterium can evade the immune system and spread throughout the body, leading to a range of symptoms and health complications. The bacterium can also cross the placenta and infect a developing fetus, leading to congenital syphilis, a potentially fatal condition. Treponema pallidum is a particularly challenging bacterium to study and treat due to its ability to evade the immune system and hide in different tissues throughout the body. This ability makes it difficult to detect and treat the infection effectively, leading to long-term health complications if left untreated. Understanding the bacterium behind syphilis is crucial to developing effective treatments and preventing the spread of the infection. With proper diagnosis and treatment, it is possible to eradicate the bacterium and avoid the serious health complications associated with syphilis. The diagnosis. Syphilis is a disease that can have fatal consequences if left untreated, making early diagnosis crucial to effective treatment. Luckily, there are a variety of screening tests available to detect the presence of this dangerous infection. The Rapid Plasma Reagin and Venereal Disease Research Laboratory test are the most commonly used screening tests for syphilis. However, if either of these tests come back positive, an additional test is necessary to confirm the diagnosis. If a chance is present, a physician may choose to swab the area and examine the sample under a microscope to check for the presence of the bacteria. Pregnant women should be especially vigilant about screening for syphilis, as the infection can spread to a developing fetus and lead to serious health complications. If syphilis is suspected to have progressed to the late stage and involve the brain, a physician may perform a lumbar puncture to obtain a sample of cerebrospinal fluid for testing. This procedure is crucial for accurate diagnosis and can help guide the treatment decisions. If one is diagnosed with syphilis, it is important to inform their intimate partners so that they can be tested and receive treatment if necessary. One mustn't let the fear of a positive diagnosis keep them from getting screened. Early detection and treatment can mean the difference between life and demise. The symptoms. Syphilis develops in stages, and symptoms vary with each stage, but the stages may overlap, and symptoms don't always occur in the same order. One may be infected with syphilis without noticing any symptoms for years.
A few prominent signs that may occur. Firstly would be skin changes like a rash, hair loss or skin growths and subsequently develop into an ulcer or multiple ulcers that are often painless, firm and round. And if left untreated, the disease progressed to the secondary stage within 1 to 2 months. Syphilis is referred to as the Great Pretender as its symptoms are varied and can mimic many other diseases. The infection can be divided into a few stages: primary, secondary, latent, and tertiary syphilis. You can start to show symptoms of syphilis 10 days to 3 months from the exposure.
The 3 stages. The symptoms of syphilis generally depend on what stage the condition is in. Here are the 3 horrifying stages of syphilis infection that will send chills down your spine. 1. The primary stage. Imagine the horror of discovering a painless sore in your intimate areas. It's just a small round sore, but it's unlike any other you've seen before. This could be the first stage of syphilis. The bacterium, Treponema pallidum, has invaded your body, and the chances is visible evidence of its presence. The first stage of syphilis is characterized by the presence of a sore known as a chancre in the privates, oral, or rectum regions. The chancre is usually small and round and may appear as a firm, painless, and raised bump or sore. It is important to note that the chancre is usually painless to touch, which distinguishes it from other intimately transmitted infections that often present with painful sores. The time between infection and appearance of the chancre usually ranges from 10 to 90 days, with an average of 21 days. The chancre typically lasts for 3 to 6 weeks before healing on its own, even if left untreated. If the chancre goes unnoticed or untreated, the syphilis infection will progress to the second stage, characterized by a rash and flu-like symptoms. However, during the first stage, it is possible for the syphilis infection to be spread to intimate partners through skin-to-skin contact with the chancre, even if the infected individual does not show any symptoms. It is important for individuals who suspect they may have been exposed to syphilis or who develop a chancre to seek medical attention and get tested. This can help prevent the spread of the infection to others and allow for early treatment, which is highly effective in treating syphilis in the early stages. Number 2, the secondary stage. As the first stage of syphilis comes to a close, the second stage of this insidious infection rears its ugly head. It's a time when the body is under attack, and it shows in the array of symptoms that come with it. The most prominent symptom of the second stage of syphilis is a widespread rash that covers the body, including the palms of the hands and the soles of the feet. This rash is a sign that the bacteria has spread throughout the body, and the immune system is working hard to fight it off. The rash itself is rough, reddish-brown, and often accompanied by wart-like sores in the mouth or genital area. While the rash is not typically itchy, it can be alarming to see it appear so suddenly and extensively. Along with the rash, individuals with syphilis may also experience flu-like symptoms such as fever, sore throat, and swollen lymph nodes. Muscle aches and hair loss are also common during this stage of the infection. While these symptoms may go away on their own, without treatment, the infection will progress to the latent stage, and the bacteria will continue to spread and damage internal organs. It's essential to seek medical attention during the second stage of syphilis to prevent further complications and ensure a full recovery. 3. The latent stage. During the latent stage, the infection remains present in the body but may not cause any outward symptoms. This is a dangerous time, as the person may not be aware of the infection and unknowingly spread it to others. The bacteria can still be active and damage internal organs such as the brain, heart, and blood vessels. If left untreated, the infection can eventually progress to the tertiary stage, which can cause severe damage to the body and even be life-threatening. 4. The tertiary stage. The late stage of syphilis, also known as tertiary syphilis, is the most severe stage of the disease. If syphilis is left untreated for many years, it can progress to this stage and cause devastating complications. The symptoms that can occur during this stage are numerous and often debilitating. They can include blindness, paralysis, aortic aneurysms, dementia, deafness, and even passing away. In fact, about 15 to 30% of people infected with syphilis who don't receive treatment will develop complications associated with tertiary syphilis. During this stage, the disease can damage various organs in the body, including the brain, nerves, eyes, heart, blood vessels, liver, bones, and joints. These problems can occur many years after the original untreated infection, and the consequences can be severe and life-threatening. Congenital syphilis. Oh no, mother! Babies born to women who have syphilis can become infected through the placenta or during birth. Most newborns with congenital syphilis have no symptoms, although some experience a rash on the palms of their hands and the soles of their feet. Later signs and symptoms may include deafness, teeth deformities, and saddle nose, where the bridge of the nose collapses. However, babies born with syphilis can also be born too early or may pass away in the womb, before birth, or right after birth.
We've seen over a 30% increase in congenital syphilis actually been screened for syphilis but did not get timely treatment. Perinatal syphilis, where a mother who is infected with syphilis can pass it to her baby. And if the baby does survive during the pregnancy and is born with congenital syphilis, unfortunately, the infection itself during pregnancy, cases in the last several years, will be in the neonatal intensive care unit for carries a 30 to 40% perinatal loss rate. Sadly, the baby, I believe that partially we are not being vigilant about over a week screening and treating pregnant women.
Treatment and prevention. This is an acute infection with the potential to become chronic if not treated with antibiotics. After undergoing proper testing, anyone diagnosed with syphilis should be treated with antibiotics. The preferred treatment is a shot of penicillin G benzathine. People who are allergic to penicillin should undergo allergic desensitization, as this antibiotic is considered superior to other drugs in treating this condition. The best method for preventing syphilis or any STI is through abstinence from intimate adult physical acts. However, abiding by safe intercourse practices through the use of condoms, limiting your number of intimate partners, as well as getting regularly tested for STIs are all effective strategies. Anyone who detects a chancre in their mouth, rectal, or genital region should seek further consultation from a healthcare provider. In addition, anyone experiencing flu-like symptoms, rash, swollen glands, and unexplained hair loss must too consult one's doctor. For early diagnosis is key, the sooner the better. That's all for today, folks. We'll see you next time.